Well, hello everyone. I don't know your names, but I've been introduced to you by your wonderful instructors, Mary and Tim. And Mary and Tim got me out of bed pretty early here in the United States, which is a good thing. Just to say a few words to you about biodynamic cardiovascular therapy, I'd like to introduce you to biodynamic cardiovascular therapy. And one of the things I want to say first about that is that the reason biodynamic craniosacral therapy is evolving, it hasn't changed names. It's just a question of focus. So if you're focused on the cardiovascular system, then you're doing biodynamic cardiovascular therapy. And then the question becomes, why have we shifted the fulcrum of attention? Dr. Sutherland, the original fulcrum was on the fourth ventricle, and Jim Jellis shifted the fulcrum to the third ventricle of the brain. And that was not an easy thing to do in the history of our work. And we live in a time now, and we've been through it, and we've been through everything that's going on in our civilization, and we see what's going on in our civilization. And we know medically now that the damage, if we want to call it, or the upset, is with the human heart. And for instance, in the United States, the research is very clear that 93%, and I want to say that again, 93% of Americans have a metabolically unhealthy heart. And so the pathology of our time and the disruption of our time is not so much about anatomy and physiology, although it involves that, but it's now in the domain of our instincts as they relate to our metabolism. In the same way that anatomy relates to physiology, our instincts relate to our metabolism. And so we can use the skills we have, the perceptual understanding, the perceptual knowledge, and the palpatory knowledge, and we can shift and we can allow that knowledge to have an impact on the cardiovascular system and the heart. So I expect you're going to learn some embryology regarding the development of the cardiovascular system and its connection with cardiogenesis, the center of human existence in the heart. And so the first reason for this is because the contemporary client is not well. And we have skills to connect with the health. That's our work. That's the essence of biodynamic practice, is to connect with the health as we know it through the perception of primary respiration and what I'm calling luminous stillness or dynamic stillness or the still point, however that terminology is. But those are perceptions of slowing and stilling down. And that's precisely the way in which the molecules of the human body and the molecules of our entire universe work. They work best by slowing down and becoming still. We know the whole lining, the endothelial lining of the cardiovascular system, is comprised of what are called quiescent cells. There are 7 or 8 levels of biological stillness. So we are going to bring biodynamic skills to, and you are going to bring them, Tim and Mary are going to bring them to you. And these skills are going to be able to bring the health and help shift the metabolism of your client's body. The contemporary client is a metabolic mess. I've been studying and writing about metabolic syndrome now for probably 15 years. And so the end result is simply bringing biodynamic skills, craniosacral therapy skills to the cardiovascular system. And that's really the essence because it's the metabolism that we want to shift. And Tim and Mary are extraordinary wonderful human beings, and we'll show you how to do this. So thank you, and welcome to this wonderful world. Thanks, Tim. Mary, thank you for this opportunity, and thank all of you listening.